and I am applying right now for, or I already applied for family residency program. So I'm going through like the interview process. But since I'm assuming, or what I was told is that a lot of you are college students, I would just like to share my own experience and feel free to just either unmute yourself and interrupt, that's fine, or in the chat box, like ask questions, just ask away and I will, answer as much as I can and to the best of my ability. So, my mother's a physician. She's a nephrologist, a kidney doctor. Yeah, family medicine is awesome. And that was from the chat box. And and so I was always like pretty influenced by becoming a doctor. Um, but I one thing I would say is that, especially in college, is to like explore all of your options. Like I felt that there was some pressure to become a doctor because one of my parents was a doctor. And so like I did feel some type of way of becoming one. And I didn't explore as many options as I could. And which is why now I have a YouTube channel, because like I would have loved to have gone into like some sort of like social media realm. And it worked out better that I did go through medical school and become a doctor and now incorporated my YouTube channel, which is about comprehensive sex education, because now I get to do it from an educational standpoint. So that is like one of my like biggest and first pieces of advice in college, is for you to explore all of the options. And even if you feel like you're committed to medicine, if there's like even a shadow of a doubt, explore it. Like it's okay. So that's like number one thing. And I just want to make sure I'm not missing any. Okay, all right. I'm just checking the chat box, but it's all good. Okay. So that's first thing. Second thing is I didn't feel that I had like a step-by-step direction of like how to do this in when I was an undergrad. I was like, okay, like what is it exactly that I need to do to get admitted into medical school? And I feel like because it was like a bit of a gray area for me, that it was more difficult for me to go through the process. I was like, okay, like I feel like it was, looking back retrospectively, it would have been great to see, okay, what is my end goal? Like, okay, my end goal is this medical school. And so if you have your end goal in mind of which medical school you want to get into, and if that is like the big thing that you're working on, like a specific medical school, then I would work back from there. So like, then I would, look at the medical school. What is it that they're interested in? Like, even, I tend to be a little bold with this, but like even like reach out to the medical students that are there, like check, like stalk them on Instagram, like see who's there, see who's in that school, so that you can message them and DM and be like, what did you do? What did you and your friends do? Like how did you how did you just like do awesome in your college process in order to get into this med school? Because this is my dream. So like I would definitely start off there, and then even look at who the heads are of that medical school, like who's the dean, who's the assistant dean, like who are the people that are going to do the admitting. I see that there is a question. Is there going to be poll questions?
No, from our end, there will not be. So
Okay.
just listen today, guys. You're good.
Okay. All right, cool. Yeah. Glamour Puss MD. That's my YouTube channel, by the way. And so, yeah, like I would even look at like who's admitting medical students. Like, when I was applying to college, like I did that, and I went to George Washington, in Washington, DC for my undergrad. And I'm half Cuban, right? I'm half Cuban, half Jewish. And so, but like really like culturally Hispanic. And I saw that the person interviewing me was like obsessed with Cuba. And so like there's just like those little things like that. If you do like really good stalking on the internet, and like, thank goodness we have the internet, that you're able to like see what people's interests are. Like if you do know somebody that is going to be looking at your application, like have it stand out, like have them like be like, wow, that person relates to me. So that's something else I would do. Like if you have something, if your sights are set on one specific medical school, work backwards from there. If they aren't, for me personally, I feel like I'm a very non-traditional medical student. I went to a Caribbean medical school because when I was an undergrad, like I did not have like the priorities straight. Like it was kind of like I was in the midst of like, is this really what I want to do? And then also like, how the heck do I do it? Am I allowed to curse? I was like about to drop an F bomb, and then I was like, oh my God, I can't. No, okay, all right, cool.
Go ahead.
Okay, all right, cool. So yeah, this isn't an interview. I wouldn't even curse on interviews, but nobody's interviewing me here, so we're fine. So yeah, like it was like definitely like an emotional roller coaster of like, is this really, really, really what I want to do? And then on the other end of it, it was like, okay, if this is what I want to do, like how the F do I go about doing this to perfection? And a lot of what I did, and maybe a lot of like medical students, because some of us tend to be type A, I wouldn't exactly put myself in that category, but like, it's like, it has to be perfect. And I wouldn't get caught up in that mentality. Like, it's not going to be perfect. Like, there's going to be a lot of bumps in the road. And so, just like having that in mind, that you're working towards an end goal, you're going to get to that end goal regardless. Like, if you're putting in the work, you're going to get to the end goal. Because, like, I also did a post-bac after college before I went to medical school, because like my like bio and my physics probably were like they were not like A's or B, like they were probably like C's and D's, right? Like I needed to do a post-bac. So I was like, and like that just created a lot of more like self-judgment and self-doubt that like I wasn't this perfect medical student. But also I feel like that allowed me, like the struggle that I had to go through, because there was a shit ton of struggles to go through, like getting into medical school and then like going through medical school. But like all of those experiences that you have, like they really do make you like a more whole person and like a more relatable physician when you do end up becoming a doctor. Like another thing I would even tell myself is like not to be so freaking stressed out all the time. Like it's going to happen. Like you're going to become a physician. Um yeah, it's just putting in the work. When you put in the work, it happens. Like it's smooth sailing. Yeah, guilty of that. I hear you, Stephanie. Definitely. Okay, so like what else? Gap year. Yes, I totally took a gap year. I'm going up a little bit. Post-bac is post-bac is when you take classes like after college to like improve your GPA and like maybe take more time to do more classes to improve like your GPA in order to get into a medical school. So like some people will do a post-bac program, some people will do like a graduate program or a master's or something like that. Just to like, I guess, like make your resume stronger and your GPA better. So the medical schools are like, oh, okay, they can go through a grueling medical 4 years. How much, oh my God, my Mcat journey. Like I said, I am so non-traditional, guys. Like I am the most non-traditional. Like my Mcats were like a 19. I don't even think they do 19s or 20s anymore. Like it was like so low, and I studied for it twice. But like honestly, like I was like my heart was not in it. Like my heart wasn't in it. I was exhausted. I was what's an SMP? I needed to refocus. I was drained. I wasn't having fun. And like, when you're not having fun, like nothing that you do in life is fun. And that's what I had to do when I was in medical school. Like, I was like, okay, I'm studying now 7 days a week, 12 hours a day. How are we going to make this fun? And that's like what I didn't have those tools when I was in college. To make studying fun. And so like MCAT was just, it was a fucking disaster. And it was not, like I did not prepare for it well. So like if you're preparing for it well and like doing amazing, like good for you. If you're not, you still can become a doctor. It's still going to be okay. Yeah. Okay. Sorry, guys. I didn't even see that we were asking questions. Post-bac. I took a gap year. I took a gap year doing my post-bac. I went to American University of Antigua, which is in the Caribbean. Rachel can relate to the perfectionisms. Yeah. Juggling a lot. You know, juggling, as long as you're having fun, like I'm juggling a lot of things right now, but like I'm having fun while I'm doing it. And my time management is like down to like my 15 minutes, my time management. Like I'm writing a book right now for medical students, which hopefully like socially distance shadower is like, I'll send you guys the book. It's like how to get through med school. It's like the thriver's guide to medical school so that you're not like just surviving and just cramming. So like I'm writing a book. I have a YouTube channel. I have a podcast. I'm doing interviews. And then I'm starting a business right now. And like, that's a lot of things. And it's like for mental health for medical students. And like, it's a lot of things, but I'm having so much freaking fun while I'm doing it that it doesn't feel like a lot of things. And that's why I think it's really important to create fun while you are studying. Whether that's studying in a group, you know, like taking a break every hour and like dancing, like I don't know, whatever it is, like just as long as you're having fun, like that is definitely the most important thing. I did not apply to medical school more than once. I applied once to a Caribbean school, got in. I had to take like, oh yeah, the stigma. That's funny. I had to take like a pre-med prerequisite course. Like basically in my mind, they were like, you need to take this. And I was like, I'm a fucking idiot. Like they don't even allow me. I can't even like just go into medical school. Also not the case, like whizzed through that with like flying colors, did so great because I studied my ass off. Stigma between Caribbean medical school and US medical school. Honestly, all of my friends that have, like there is a stigma. And it's funny because like my mom went to a Caribbean medical school and then did a fellowship at Cornell and then her MPH at Columbia. And now she's like this like boss ass bitch CMO of like this organization, like all in New York. Like if you want, that's again, that is what you are, where you are right now, you know, like where I was when I was in college, like I did not have the MCAT scores. I was not in the mental state to get an MCAT score of whatever level it is now. I don't even know what it is right now, of that level to even apply to a US medical school. If you can, go for it. If you can't, my friends are from AUA, from like the Caribbean Medical School. My friends are surgeons. My friends are radiologists. My friends are like, they're all like, they're at the highest levels that you can be, even if you graduated from a US medical school. And then when my US medical school, when my best friend who was an OBGYN and she went to a US medical school, when she went down to visit me at a Caribbean medical school and like saw where I lived, like on the beach, she was like, I fucked up. But she didn't, you know, like she was in Scranton, like it's cold in Pennsylvania. But again, that's like total personal choice. Okay. I'm just going all the way up. Which med school did you attend? Oh my God, another Cuban here. What's up, girl? Okay. Do you know who's interviewing before you go on the interviews? You don't. I don't think so, at least with medical school. Okay, now I'm going down. Which would you recommend? Which Caribbean medical school to pre-meds in the same position that you were in? I liked AUA. You know, you just have to read a couple reviews online. It's wherever you end up, there's going to be people complaining about it. You're always going to have optimistic people and you're always going to have pessimistic people, like no matter what you do or where you go. So it's really on how you look at it. Like if you're in that position and you are like, okay, I might have to go to a Caribbean medical school. I had a fucking fantastic time. I did amazing. I like thrived and it was a great experience for me. But that's just because I'm an optimistic person. If you see yourself maybe more as a pessimistic person or like you complain about a lot of things, totally fine, by the way. But if that's like who you are, it might be more challenging for you. Um, okay, I'm going down. I did not apply more than once. Goes back. Okay, gap year. I actually did 2 years of a gap year. One was like one was my post back, and like my second year, again, non-traditional. I like took a year to like find myself. I was like, I got a job. I was like, I worked for like this NGO, which is like a nonprofit organization over by the UN. I like traveled to Colombia to like help teach like college students about the importance of recycling. Like, I don't know. I just did like some other things. And it really did help me find myself a little bit more. Like it was definitely fulfilling. I would say that. And then also just to like piggyback off of that a lot is, if you can, I know this is like easier said than done, but like find yourself, like find what your passions are, find something that's like really just like individual to you. What's individual for me right now is my sex ed YouTube channel. Like there's maybe like two other medical students that I found like on Instagram that are medical students with sex education. And I'm telling you, the residency interviews that I'm going on right now, like program directors are like losing their minds. They're like, you have a YouTube channel? That's so cool, on sex education. That's so like on family medicine. Like that really shows how much you care about preventative medicine. Your thing does not have to be a YouTube channel, but what I'm saying is like make something like, like find your niche. Like what is it that is like really special to you that has you stand out? Because that's what the interviewing process is about. It's about networking and it's about standing out. There are thousands and thousands of applicants out there. So like don't be so cookie cutter. Like it's okay to like scribble outside the lines because it will have you stand out. So like if you could find that thing about you, I would hone in and like really put your energy into it. Okay, post back. It can, yeah. So a post back can often enhance your application. It's not. I mean, it's only recommended if your GPA or if you need it in your resume. Like yes, it's it's great to be different. It's great to have all of those individual characteristics, but you still have a medical school that is filtering you out unless you have a certain GPA or a certain, Mcat score. And like, unfortunately, those are still the rules that we're playing by. And it's not like, it's still like numbers based, even though like things are changing little by little. And I don't think numbers based is a great indicator of how you are going to be as a physician. And there are certain schools and certain things that are changing finally, where people are realizing that being a good physician is actually how personable you are. And do you have empathy? And can you make an impact on your patients? And I think Mount Sinai is one of the first schools to have done that. So like, and don't quote me on this because like I read like a blurb about it like a couple years ago, but basically what I'm seeing like medical schools are, or at least more progressive medical schools are looking at, is actually they're not looking at your MCAT scores. And again, this is very few and like far and few in between. Like this is not across the board. But what they're looking at is like, what humanity classes have you taken? Like, how do you interview? How are you in conversation? And even one of the medical board exams have changed. So before the medical board exam, like the one to become like that you take after medical school, it was the one like interacting with patients. It was based off of a pass fail. So it was like pretty easy to pass. And now they changed that to a number system because they're realizing, oh, like it really is important to see how a person is interacting with other people. Extracurricular activities. How much extracurricular activities is enough or does it not matter? That's a great question. And I think I would default back to do extracurricular activities that are important to you. Like I did like some like research, not extracurricular, but I did like some like research thing to put on my resume. I hated it. It was so boring. I was so not happy in it. And if I just put my energy into something that like resonated with me more, I think it would have made a bigger impact on my resume. So do the extracurriculars that are passionate to you, because you know when you do get an interview, that's what they're going to ask you about, and you don't have to like memorize the script. You're just like speaking from your heart. Ha ha ha. Okay, that's another comment. SMP Special Masters Program. Oh, okay, good. Yeah, awesome. Good for you. Stephanie's taking it in March. When you were choosing a post-bac program, did you look into linkage programs? I didn't look into linkage programs. Like, again, like I felt like I did not have a good grasp on the best way to go about getting into medical school. And so that's definitely one of my biggest pieces of advice looking back, is to speak to someone or multiple people, maybe multiple people, so that you get like a good idea of how this process works. It would be a good idea though, the linkage programs. Okay. What do you wish you did in terms of MCAT studying to improve yourself? It wasn't like what I was doing or not doing. It was like how I was being disinterested. I was not being someone who was like really interested in like rocking my MCATs at the time when I took them. I was like not very much, like I said, like I was burnt out. Like I probably needed a break, to be honest. That's what I probably needed. Why did I decide on family medicine? Because it's a broad range. It's like a lot of different options that you could do. And I wasn't like, I loved surgery. Surgery was awesome. It was actually like my best rotation, but I didn't like the hours. And like, as I told you guys, like I have like a lot of other things that I'm doing. And I knew that if I'm going to practice medicine and do something that like I could also have a life work balance, like family medicine was like a great reason for that. I feel like I'm in an interview telling you all like why I want family medicine. Pre-ordered. Oh my God, Eileen, stop it. Thank you. Can't wait to read. When is your book coming out? My book's coming out in August of this year. I have one more chapter to write on my first draft and then sending it to the editor. Okay, my podcast is on relationships. It's called Relationship Happens. That one's with my boyfriends, and we talk about like really vulnerable experiences in our relationship, like all of our like awesome big failures, like all the stuff of like why we're fighting and then how we work through it, because he's a therapist. So, which also highly recommends, like, if you're not on your mental fitness game, like get on that ASAP, because you need that before you start this whole journey. Like, it's so important to like be very aware. I meditate almost every day. I can't say every day because I skip days. Like there's just such a huge component of taking care of your mental fitness. I just saw that word today. Now I'm calling it mental fitness instead of mental health, because I feel like mental health has like a stigma towards it, but like physical fitness, mental fitness, like both of those work really great. So yeah, if you're not on your mental fitness game, like get on that quick. Casual this session is, you have an interview tomorrow. Hey, Eileen, awesome. That sounds like UMHS. Good luck, Eileen. Okay. Oh, good. I'm so happy, Amanda. Good. Loving. Oh my gosh. Thank you. What is the stigma behind it? The stigma is like that medical. So here, oh, okay, yeah, great. This is the reality of Caribbean medical schools is that like in your first class, 500 people will be in your first class. And the reason is because Caribbean medical schools will like basically kind of like let in anybody, like not anybody, but you have to have like the bare minimum. And what pre-med courses, in my opinion, what those are for, they're for weeding you out, right? And if you cannot be weeded out, good thing I'm not a literature major, right? So like if you cannot be like weeded out, then then medical schools are like, okay, she or he is able to go through medical school. Caribbean medical schools, you get weeded out while you're in medical school. And it's a pyramid effect. You have a ton, they'll accept a lot of people with the bare minimum of scores. Those people, like including me, like still didn't know how to study very well. And so a lot of people fail out of Caribbean medical schools because they don't know how to study. Something shifted for me, and what that was is like I really, between college and medical school, because like I did not know how to study in college, and medical school, like I did pretty well in medical school with like a couple failures here and there because like that's just inevitable. But what really shifted for me was like believing in myself, mental fitness, like really taking really like building up my confidence basically. Does having a mentor look better for med schools? I mean, not necessarily. I mean, like, I, unless it's like in your application and you want to talk about it, but not necessarily. Yeah, anyone who's talking about being like having like nerve wracking stuff about Caribbean medical schools, like again, it's your perspective, it's how you look at it. If you're looking at it from a negative point of view, it's going to be a negative experience. That's how I think about it. How would you recommend becoming mentally ready for medical school? I mean, therapy's awesome. You know, like I took like a life course also, like that my like family had taken, and there's like a lot of those things out there. Like you just have to look for them. Like I took like this like 3-day life course that like changed my life. It was fucking fantastic. It was called Landmark Worldwide. And it was just awesome. Like I met a ton of doctors in there also. Like I met a surgeon who was like nominated for US Surgeon General twice. And he wrote one of my letters of recommendation. So like that, again, like that's just like more networking stuff, but it was just another positive because like I got a lot of like confidence and mental strength out of that program. But you know, therapy, if not that, and friends don't count as therapists because they're not licensed and trained. You know, it's just so great to see a therapist. Do you have any advice for undergrad students who go to smaller and less known universities? I don't think that I don't know a lot about that, but I don't think that really matters again. Like just because you come from a smaller university, it doesn't mean a med school is not going to look at your application. Yeah, study tips for Mcats. Like the only thing that I could tell you, because I like my Mcat studying like was not effective. My medical school studying was much more effective, and it was like having a plan of action, revision, and taking breaks. Like I never pulled an all-nighter. Never in my life have I pulled an all-nighter. Like I'm in bed by 10:30. So that's just how I lived my life. Interviewing tips in general, please. I'm coming out with a video on that on my YouTube channel, actually. I already have a video on that, but interviewing tips in general, like the person on the other screen, like that is interviewing you, is just another human being with their own insecurities, their own problems, their own shit that they are trying to deal with. Like there is nothing to be scared of your interviewer. Like they are not, I would just say like not to be scared of them because they're just another human being. Like if you speak to them just how you speak to a friend, like you're going to do great on an interview. Still reading. Medical school interview tips, same thing, be yourself. Don't be scared of your interviewer. Like there's nothing to be scared of. Do you think it will be harder for IMGs to match into US residencies with step 1 before, I don't know what P/F is. Any advice to stand out as an IMG in the residency app process? I mean, again, there's IMG friendly residency programs, and those are the ones that are going to accept you. So it's not like not, in my opinion, like it's not difficult to, I haven't found any, challenges matching as an IMG. I had 8 interviews and like that was like a good amount. Like I feel like very secure that I'm going to match this season and I'm an IMG. Also, I see there's 63 new messages like that, and I'm like scrolling through this. Like if you have a burning question, like unmute yourself, like, and you could ask me. I'm fine with that.
I think the previous question about the step 1, so it's now pass fail instead of having numbers, and step 2, like a couple of days ago, the clinical skills part was taken out. So what do you think what do IMGs have to do now to stand out even more? I think
I understand. First of all, that's awesome that step 1 is pass fail. That's like so fantastic. And that CS is being canceled permanently. This is the first I'm hearing of this. I mean, again, there's nothing that you have to do to stand out more because you're going to be applying to programs that are IMG friendly. So like all of the hospitals that you apply to will be IMG friendly. And so really you're just competing. I don't even like the word competing, but like the other applications are going to be similar to yours. We're in a doctor shortage. Like they need you. You're important. Like it's not that you're going to be at the wayside just because you're an IMG. Like there's a good chance you're going to get a residency as an IMG. Do you have any tips on how to make time for extracurriculars with a busy student schedule? Yeah. Like for me, working out was mandatory. Like there was not like, I didn't have like, that was how I got to like release release frustration. Like so whatever it is that you do in order to make yourself feel good, during like a very difficult process, like studying, like it doesn't have to be working out, but like you set time aside for that. Just like you set time aside for breakfast, you set time aside for lunch, you set time aside for dinner, you set time aside for working out. Like there's no ifs, ands, or buts around that. So like the tips is just like be intentional with your time. Like if you're scrolling through Instagram, like how long are you actually scrolling through Instagram? Are you picking up your phone 15 times a day and scrolling through it 30 minutes at a time? Like that's not intentional with your time. If you want to scroll through Instagram, that's fine. Give yourself a time to do it. 8 p.m. to 9 p.m. That's it. That's how that's what I would say about extracurriculars. Like just like be very intentional with your time.
Hi, Dr. Richman.
Hi.
I just wanted to ask if you had any experience working in the medical field before like you went to medical school, like scribing or something like that.
Yeah, I did. Thanks for asking that. So I did. I worked at a community health center in like the summers, like in between college in my summers. And I think even like in high school, in the summers, I would work at this community health center. And it was just like basic things that like a high schooler or like a college student would do, like just like honestly, like basic things. But yeah, I did have experience working in a healthcare center. And that helped like going into family medicine because like community-based healthcare centers, it was, and family medicine, like they jive really well together. yeah.
There's people asking, so they want, I think we put your YouTube up in the comments above, but if you could give your Instagram, YouTube, podcast name, book title, everyone wants everything written out. They want to support you as much as possible.
Subscribe. Glamour plus MD is like everything for, that's my YouTube, that's my Instagram. And then Relationship Happens podcast is my Instagram. And then and then my YouTube channel, and then my podcast also has a YouTube channel, Relationship Happens. So Relationship Happens is the YouTube channel that I have with my boyfriend, and it's also a podcast. It's the same exact content. It's just whichever one you want to use. And then if you follow me on Instagram, like I'll be giving out like when my book is coming out, and like if you want to be like a beta reader, and if you want to contribute, and if you want to like, you just like sign up for it, but that will all be on Instagram. How did I go about talking about sex ed? So I don't have training in sex ed. So really what my YouTube channel is, it's normalizing conversations around sex. And because like my family's Cuban, and I have like a lot of younger cousins, and like all of my cousins were asking me so many sex questions, like, you know, from like, how do you put in a tampon, to like, what happens if I skip a birth control, to like, which IUD is best. I was just like, I need to do something and like talk about this on a bigger platform, because I know that this issue is more than just my cousins. And then also that, like, especially coming from like a Hispanic background, like it's like and other cultures too, I know it's like very taboo to talk about sex. And like, I dislike that so much. Like, I just want it to be so normal, like penis, vagina, let's go. And like, just call it a day, and like, stop like being so, you know, like that it's like so stigmatized. Like, I'm like ready for that stigma to end. I recently graduated from medical school. Yes. Why did I choose to wait and apply to residency after graduation and not during your 4th year of medical school? So with Caribbean medical schools, like another thing about them is like or at least like when I was there, it's constantly changing, is you have to take a practice exam before you take your board exams. And I failed that practice exam so many times, and you can only take it every other month. And like, I'm failing it by 1 point. At first I was failing it by like 20 points. And then like, I failed it by like 1 point, 2 points. I was like right there. And that delayed me finishing graduating. Like, I finished all of my rotations, but then and then I started studying for that exam. It took like almost a year to pass that exam. And then I passed my boards with like flying colors, did great. You know, just make sure that you remember that contrast. It took me a year of failing in order to pass my boards and do awesome on my boards, which is why I have so many interviews. But there is like there can be, at least in my case, there was like a lot of failures before that. So did you start it during medical? Yeah, I started my YouTube channel during medical school. I started it when I was a 3rd year medical student. Can we shadow you if possible? That is so awesome. I wish. That'd be so cool. Instagram, YouTube channel, podcast. All right, cool. Thanks. Oh yeah, support me. Oh my gosh, that's so sweet. Admissions committee view an applicant as social media and mentor to others. So as long as they don't care, like as long as you're not like, hey, like I'm an influencer and like this is my hospital and like I'm affiliated with them. Let's talk about penises. Like they don't care as long as you're not affiliated. Like as long as you don't say anywhere, like I go to this hospital or I go to this medical school. Because then they're just like protecting their asses basically. They don't want like anything negative. So I took 2 gap years. Did it look bad when I was applying? Are there any other gap year activities that you would suggest? Gap year activities, do things that fulfill you and that you love. That is what I have to say with gap year activities. It didn't look bad because like I had things that I was doing. I wasn't just like, hey, I'm like sitting on my ass doing nothing for 2 years. And I honestly think that they respect that a little bit. Like they're like, when I was like applying for AUA, I was like, yeah, I found myself and I took courses and I learned about myself and I, went out and explored and I wanted to make sure that medicine really was my thing. And they were like, oh, wow, that's really great that, you know, you're like a wholesome person and you've had all these different experiences. And that we know that you're not going into medicine just because like your parents did, I guess. I don't know when step one is pass fail or if it's in 2022. Tips on getting LORs. Yeah, that's a great question. I got one of my LORs for a conference that I went to, and the conference was a adolescent medicine conference, because like that's what I was interested in at the time. And then I just like networked the shit out of that conference. Like I was like going, like I would listen to speakers, then I would go right up to them. I'd be like, that's so great. I would love your email. I'd love to continue talking with you. And then you just like follow up. Anyone that you connect with, really, you know, and get to know, like if you can develop a relationship with someone, and it doesn't matter who it is, and maybe I'm gonna like regret saying this, but like if you start developing a relationship with me and like message me on Instagram and be, you know, like whoever it is that you're trying to develop a relationship with, like they'll write you an LOR. Just because they're like, wow, this person's a real go-getter. Any tips for working on mental fitness? Yeah, mental fitness. Yeah, like I said, therapy. I did Landmark. Landmark was like a must, like go-to course. It was a weekend course. You have to save up for it, but like it was so worth it. Life-changing. Having 4 W's in a school will affect my chances in international. What's 4 W's?
So I think those are like, it changes from school to school, but I think it's, if I understand right, like when you drop a course.
Oh, withdraws?
Withdraws, yeah, like a withdrawal, you like it's not, you don't drop it. I think it's like after the period. Like I think if you see you're not doing too well, you kind of drop it before getting like a fail grade.
Yeah. Again, you know, if they admit you, like if you get an interview, even with withdraws or fails or whatever it is, like they're already interested in you. If you get an interview, they're already interested, and then you have a chance to explain yourself. If you have your 4 W's and they don't admit you, then you were just like, they put in something with their search and they were like, only give us applicants that have like, you know, this GPA, this MCAT, and 2 withdraws, you know, and if you don't make that cut, you're not going to make that cut. Like, it's not bad or good. That's just like what your reality is now. And you just have to find something to, you know, to make it work, you know, like, okay, if this path doesn't work out, like what's another route that I could take that will work with 4 W's. I don't know, to be honest. Like last year, I actually withdrew from applications, like from application residency, because I still hadn't passed that practice exam, and like nobody looked down on that when on my interviews. Okay, so can I explain the purpose of step 1 to step 3 exams? Yeah, they're just your board exams. It's basically step 1. I never really understood this until I got to medical school. Step 1, you get to medical school, you have your first year of medical school, you have your second year of medical school, and then you have your step 1 exam. And that's accumulation of what you had learned in your first year of med school and in your second year of med school. So then so year 1, year 2, then you take your step 1 exam. It's like a final exam, basically. But bigger than that, I guess. And then you have your 3rd year of med school, 4th year of med school, and then step 2 exam. So again, step 2 exam is just accumulation of those last 2 years. Okay. So for your post-bac program, did you complete or did you do a DIY? I don't know what a DIY is, but I completed it. All I think was like do it yourself. Oh, did I? Maybe it was do it yourself. I don't know. I completed my post-bac program. That's the answer for that. Everyone wants to know if the polls are up.
Yeah, there's no polls. If you guys have any questions for Dr. Richman, also feel free to just unmute if you don't want to type it out.
Yeah.
What other questions? So I think there was a question towards the beginning, or it might have just been a private question asking if you didn't go into family medicine, what other specialties interested you, and kind of like, is it your personality that drew you to that, or if you kind of talk about like your own personal experience? with rounding and different specialties?
Yeah, I would say so. Like family medicine definitely drew me. Like people were a bit more personable. Like I I'm an alpha female, so like when I was in my surgery rotation and there was like my attending who was like screaming at me in the OR for introducing myself, like I'm not someone to like cower and like cry. I'm there to be like, okay, all right, we're playing this game. All right, let's play this game. And like that was kind of fun for me. Except it was abusive. Like there's like a lot of, which is like there's some stuff in that in my book, but like there's definitely like some abusive behavior in medicine that I'm like so not cool with. And like I will say something even if you're a senior and you're an attending and you're 65 years old. Like it's not cool. Like even the sexual harassment case, there was like a sexual harassment case in when I was like in my internal medicine rotation. And me and the two girlfriends that I was doing my rotation with, the three of us were all like harassed with like sex and like an attending like asking my friend to come back to his house for wine and dinner. And like it was just like inappropriate stuff. And like I went to the program director and I was like, this is bullshit. Although I didn't say that and I wasn't as confident in saying that. I like literally just started crying. But there was like a lot of growing experience from that. And then his response was, boys will be boys. So that was kind of fucked up. But I did not have the ability, knowledge, resources to like pursue further anything with that. So bottom line with that is like you may or may not like experience things that are abusive. And there are stereotypically some specialties that are more like abusive, and that one like does tend to be surgery. Even OBGYN was a bit abrasive. But again, that like depends on I was in New York. I was just at like two specific hospitals. Like that doesn't mean that what hospital you're going to is going to be the same way. Like it's not like that's just what's going to happen. Like that was just my experience. But yeah, but I did like family medicine because of that. And I did like my internal rotation, set aside that sexual harassment stuff, but it was so good.
Thank you for sharing that. There was a question kind of talking about clinical rotations. So for Caribbean medical schools, do you have to set them up yourself? Like, are you actively looking for positions? Does your school set them up for you? Are they in the US? If you could kind of talk about like that aspect of it.
Yeah. So it's also, was I able to send my Glamour Presentation and all my things in there?
Yes, we all got it. And I can
Okay,
send it at the end as well. Yeah.
Okay, cool. So yeah, if you're at a Caribbean medical school, your core rotations and your electives are set up by your school. Like your school does it for you. And everything was in the US. So like I did mine in Baltimore, I did mine in New York City and Brooklyn, and I also did it in Miami, but you can have like different rotations. It doesn't have to be in those cities. Just for me, it was because that's where I wanted to be. But yeah, it all, they set it up for you and all of them are in the US. I'm pretty sure regardless of what Caribbean medical school, if you are planning on that, they will all be in the US.
Okay, that's good to know. And then I don't know if you feel comfortable talking about this, but someone asked kind of like for funding for medical school, how was that financial aspect of going to medical school?
Yeah, I mean, there are a lot of options for financial aid and your school will provide them. Like, that was actually something that was really good. Like they follow through with financial aid because like clearly it's an issue, unless you're going to like NYU medical school because that's free. But yeah, it's very much like talked about. It's very well, it's provided, like they give you the resources, you know what I mean? And you have like financial aid advisors, like it's comprehensive. That's what I was gonna say.
Okay, that's good to know. I think a lot of people are kind of worried about that aspect.
Yeah.
Let's see, what other questions? Oh, there was a question I remember earlier. I think someone wanted to go kind of like the PA route. And so do you have any advice for, not just future medical students, but also those just in the general health field?
Yeah, I mean, PA, nursing, like those are other like equally awesome options. I think even like the PA route, I feel like it's like shorter period of time. You basically do everything that a doctor does. I honestly don't know that much of, I don't know the difference that much. I just know that like PAs, like they could even like write scripts, but like I think the doctor has to like sign off on it. Um, but I'm not sure exactly.
Okay, yeah,
Google
totally
would know.
fair, totally valid. Um, oh, there was I don't know if you would know about this, but someone said, are there catches to free medical schools that we should be aware about? Or is it just kind of like, if you get in, you get it and it's free?
No, I mean the only thing is like I just know that NYU med school is free tuition. I mean no tuition. Yeah.
Okay. So kind of based on what you were saying of exploring all your options, someone asked, how do you recommend exploring other career fields? As an undergraduate student, I feel like there's a lot of pressure to complete all of the pre-med requirements ASAP, and that doesn't leave much room for non-medicine exploring.
Yeah, I mean that goes into like it just goes back to like cookie cutter. Like if you're gonna go to like how they recommend you do it versus like how you want to do it. And I know it's so difficult, but like they need to put a structure in place so that you feel like guided. Like I studied abroad, like that's not recommended at all. But like I also didn't want to give up that experience. And like I said, like I think it was a combination of like me not um like not understanding like the whole like not being comprehensive with how this process worked that did lead me to a Caribbean medical school. But now I'm looking back, I'm like, being in a Caribbean medical school like really didn't make that much of a difference. Like when I look at my friends who went to US medical schools and then my friends who are residents right now from a Caribbean medical school. And if I had to do it over again, or the DO route's pretty badass actually. Like I would do Caribbean over again. I would. Yeah, I would not change that. And the DO route, yeah, I mean, again, I would probably also do DO if I had the chance because like their like manipulation techniques, like physical manipulation, not like mental manipulation, like is really cool. And also I have to reiterate, like, if I'm painting a beautiful picture of the Caribbean route, it's because I'm a very optimistic person. Like you just have to look at yourself to see what type of person you are. Like I could turn anything and spin it into gold in my head. So like you really just have to know yourself best to see what's going to work best for you. And I think that even kind of tied back into the previous question of like going about it the exact way that they want you to do it. Again, you have to know yourself best. Like, are you going to, like, for me, I wasn't willing to compromise my happiness. That's what it was. Like, I was not willing to compromise that on any level. And if they said I had to do it this way, and that compromised my happiness, I'm going to find another way to do it.
Yeah, thank you so much. That's awesome advice. And I think it is definitely hard when you kind of have this like set in stone idea of what you're supposed to do. So it's great to hear that you don't have to do that. You can definitely make your own path.
Yeah.
We're kind of like rounding out right about to the hour. So if you guys have any other questions, I'll put your Instagram in one more time. And then if you guys have any questions, feel free to follow Dr. Richman. And I guess our last question for you that we have as we wrap up, and you've kind of been talking about this like throughout your session, but if you could leave us with one piece of advice You know, we're pre-med students, college students, post-bac students in this time of COVID. We're struggling. So if you have one piece of advice, what would you leave us with?
One piece of advice is, and my cat's joining us now, is don't let anyone tell you that you can't do it. Like whatever somebody says that you cannot do, like don't listen to them. You are more than capable of figuring it out yourself, and just believe in yourself that you can. But nobody's capable of telling you that you can't do something. Like you can't, you know, become a doctor. It's such bullshit. Yeah.
Thank you so much. That was awesome. I guess you can see the chat just kind of like blowing up with thanks and praise for you.
Thank you.
But yeah, definitely follow Dr. Richman. She has awesome videos, awesome content.
Thanks.
And we're so glad that you could join us.
Yes, for sure. Thank you guys so much.